I'm Diane Meves. I am User Experience Manager for The Ohio State University. I've been in that role for about 5 years. I'm pursuing a certificate in Usability and User Experience in healthcare at Ohio State. So I've been a user experience professional for about 20 years, working in websites and everything online. I was interested in what has changed in the industry. So when I saw that there was a certificate program for UX in healthcare, that is an industry that I think has a lot of staying power. And so I was interested in seeing what new information I could learn. Things I enjoyed in this program, I really liked the format. It became a very systematic process to kind of watch the lecture, read the readings, and take the courses and the quizzes. So I really liked that it was understandable and easy to pursue as a mom and someone who has a full-time job. This was a really great opportunity and a great way for me to study. I was able to reach out to my professors and ask them questions, and they were very responsive. One of the assignments that we had was a group project, and so working asynchronously, I was able to meet with my partner at a local library, and we were able to get our work done together. So even though it was an asynchronous class and most of the work was held online, it was really easy to meet students in the class. I found that the information technology course was really helpful. It not only let me remember back to all of the different methodologies that we've used, but I also learned some new ones. In fact, like the system usability scale is one of my favorites, or SUS as it's called. And it's an old methodology, but it's basically a way that you ask questions about a user's experience in software design. And it's really a helpful way to balance a scoring system so that you can see improvement over time or improvement or benchmarks against other competitors. I find that learning a little bit more about some of these methodologies brings a little more credibility to my work. I love the fact that I can mention this is being taught to students today, and it gives some relevancy to a lot of user experience principles. Each week we tackled a different subject, and there was one unit on automation, and the future of AI and automation is going to be really interesting. And so they talked a lot about patient outcomes and how we can make sure that we're designing for safety when it comes to using AI, which is definitely a topic that everyone's talking about right now. I'm interested in keeping kind of my curiosity going and taking more of what I've learned from this class into my day-to-day project work.